Hello, my name is KJ Lazarus. I am an MS nurse of the NCREST service at the Austin Hospital in Melbourne, Australia. I've worked as an MS nurse for about 20 years now, and I'm very passionate about working with people with multiple sclerosis or MS and their loved ones, especially regarding the topic of continence and intimacy well-being. And I love providing education and understanding on these topics for pretty much anyone who'll listen. Thank you to MS New Zealand for inviting me to talk to you about bladder and bowel dysfunction in multiple sclerosis and what it's all about. So can bladder and bowel problems be a symptom of MS? Absolutely they can. Whether you are male, female, newly diagnosed, have been living with MS for many years, or everybody in between. It can also occur at any age and at any time through a diagnosis of multiple sclerosis. If you are one of these people, please know that you are not alone. The demyelination and inflammation that is MS that causes lesions, those lesions interrupt the way the bladder and bowel function works, affecting bladder and bowel storage or emptying, or the transit of it through the body, or a combination of these things. In MS, it's more common than most people understand it to be. There is a lot of information out there, but it's fair to say that about 60 to 65 people living with MS have some level of bowel dysfunction, and about 90% of people living with MS have some level of bladder dysfunction. So it's very common, and despite this, we find it's still not fully disclosed with our neurology consults. In my clinical experience, whether that's through neurology or back in the day in critical care, people are often very reluctant or feel embarrassed to talk about how their bladder and bowel are going, what their patterns are, what their habits are. And so despite this being a very important part of their health, it's still not openly discussed. So we're trying to improve that. The reason for this reluctance can be many reasons, from stigma, embarrassment, social expectations, or just thinking it's part of having had children, aging, and not being able to understand the link between MS and bladder and bowel dysfunction with your symptoms. If you're one of these many people and you've been reluctant or hesitant to talk to your healthcare professional about your bladder or bowels, please know you are not alone. And it is important to talk to us as your healthcare professionals, neurologists, GPs, anybody about it. And so please try and talk to us about it. It is also well known that symptoms of the bladder and bowel can have significant negative and limiting impacts on activities of daily living and quality of life for people living with MS. They can also worsen other symptoms of MS, such as fatigue, cognition, and also lead to social isolation. So early intervention is really important. Understanding the symptoms and what is causing them, knowing that there are very effective management strategies that are available out there and that can improve your quality of life and your activities of daily living, can be very empowering. Getting on top of these bladder and bowel symptoms early can give you control over those symptoms, reduce developing structural changes to the bladder or bowel, and to reduce the risk of developing urinary tract infections, which can lead to hospitalizations and other health complications. Effective and early intervention needs to come from early conversations. So if you're experiencing problems with your bladder or bowel, or just have questions, please take the step, be brave, have some confidence, and trust talking to your healthcare professional about your symptoms, and we're here to help. As one of the many invisible symptoms of MS, and as MS is different for everyone, everyone's continence dysfunction can be different too. This is why it's so important that you talk to your healthcare professionals about what your symptoms are, what you're experiencing with your bladder and or bowel, and so we can help you and your individual needs.